Hello and welcome to Aesthetic Insider Radio. This is your host, Angela O'Mara. So today we're going to talk about what's new in neurotoxins. As we know, non-invasive aesthetic treatments are at an all-time high, and treatments for crow's feet and wrinkles offer many advantages to patients. In this interview today, we have Dr. Shweta Agarwal, a triple board certified aesthetic medical doctor who practices at Mia Maven Medical Spa, located in the heart of Santa Monica, California. Dr. Agarwal has an amazing reputation for her scientifically based rapid facial wrinkle reduction technique that can quickly transform a patient by helping make them look much more youthful. Dr. Agarwal, welcome to Aesthetic Insider Radio. It's a pleasure to have you back on the show.
Good morning, Angela, and thank you for that lovely welcome. It's my pleasure to be back talking to you and talking to our audience today.
Absolutely. And, before we do get going, because I know there's so many things, that are new with neurotoxins and cosmetic facial enhancement. And so before we dive into those questions, please tell our audience a little bit more about yourself.
I would love to. We are, like you mentioned, I am a triple board certified physician who has been practicing medical aesthetics for quite some time. I practice at Mia Maven, which is a small boutique type spa located in Santa Monica. We have very friendly, very personable staff and some of the best injectors in the industry. We do have a variety of lasers, variety of ablative, non-ablative lasers. We practice minimally aesthetic procedures, which means any aesthetic procedure that can improve or enhance your looks with minimal or no downtime in office procedure and without putting you to sleep. My area of interest, my area of expertise lies into injectables, including dermal fillers, including neurotoxins, including pedio threads, and so forth. So today's topic, discussing about neurotoxins, it's really an interesting one, really one of my favorite ones. So let's dive in.
Absolutely. Well, as we kind of mentioned, with your practice being in Santa Monica, California, which, LA is still considered by many around the world to be the epicenter of plastic surgery and aesthetic beauty. And I do know that you have a huge celebrity Hollywood following. But as we mentioned, in the last year or two, just the growth in non-invasive, non-surgical treatments for aging has just skyrocketed. And so I would imagine that this is not only the request of Hollywood celebrities, but probably many people from all walks of life. Is that what you're finding in your practice?
Yeah, of course. Like you mentioned, we are located in Santa Monica, which definitely makes us very approachable place for the Hollywood celebrities, for the industry. And we do cater quite a few public figures. I wish I could share their names. However, to answer your question, Angela, I would say this, that looking your very best, looking youthful at any age is not just a privilege of few. It's the very right of all. To look beautiful, to look youthful, that's the most aspiring thing from Greek era to the Romans to the 1950s Hollywood. And now, in the world of social media, it's a very desirable thing by one and by all. And, today's world of minimally aesthetic procedures have made it possible for all of us to look beautiful with, without the fear of going under the knife, without, without taking time off from work, without, hiding for a while post-surgery. So, it's very desirable thing and people are seeking it. And I feel what we are practicing these days, or what we call is performance beauty, which means that, beauty to what you are looking for, getting the looks, getting the youthful looks that you are looking for, not necessarily what's iconic there. I feel that, doing these procedures, doing these minimally aesthetic procedures these days, just makes it possible for us. So when we, look in the mirror, we look better. That improves our self-confidence, that boosts our self-confidence. So just helping us make a better version.
Oh, no, no. Now we're talking about, like, the title of our show is What's New in Neurotoxins. And so, neurotoxins is, of course, a scientifically known name. And I think, there are, it has been traditionally known more for Botox. But there are many other brand names, such as Xeomin, Dysport, Jeuveau, Nutox. And so I think it would be helpful if you can kind of just talk a little bit more about, what is this neurotoxin and what are those other brand names that you use, and what are the different advantages and results that you find, amongst your patient base?
Right. Yeah, the word neurotoxin sounds a little scary when you hear toxin in the word. But honestly, the neurotoxins, these are one of the most researched products in the world of medical aesthetics. The scientific name is called botulinum toxin A, which is actually a very purified protein produced or manufactured in the settings which are really safe. There are a lot of clinical research and data behind these products. The way these products work is when they are actually placed under your skin, they help basically what they do is they block the message of the nerve to the muscle, helping to relax the muscle, stopping the action of that muscle. Just to explain a little bit more on that, say if you're squinching your eyes and you see that, you have these wrinkles in between your eyes. After using these products, what they do is they help relax those muscles in between your eyes which are squinching, which are causing those lines. So the muscle get relaxed, and in turn, the skin which is folding or creasing get relaxed, which in turn helps smoothen your skin and release that wrinkle. So that's how they work. The conception or misconception goes that, oh, they are erasers of wrinkles. No, they are not. They are just wrinkle releasers. They are just relaxing those wrinkles. There are, like you mentioned, a variety of products, what we have right now over time, and they are all great products. To name a few, like you mentioned earlier, we have what we literally make it synonymous with neurotoxins is Botox, which has been there for almost 2 decades now. Great, great product from Allergan, with a lot of clinical research, a lot of data, a lot of safety profile around it. Has been FDA approved to be used in upper facial areas simultaneously in 3 regions, forehead, frown lines, and your crow's feet, or what we call lateral canthal lines in medical terms. Then there is Dysport, which is from company Galderma. Then we have Xeomin, which is from Merck. Then another one which was FDA approved recently in 2019 called Jeuveau, which is from the company Evolus, which is basically approved just for cosmetic use in between your forehead lines. So those are the 4 products we have in United States. There is another one actually on the horizon which should be coming out in the market pretty soon with the name, I believe, Daxi. This one is probably going to be a little bit more revolutionary because it's going to be much more longer acting. So I'm waiting for that one as well. But yeah, currently we have 4 available ones, which are great products and, which are very safe and predictable products.
It's so exciting as well when you say, and there's new things on the horizon too, which is like,
Yeah.
goodness, it's just a never-ending fountain of youth, that is just continually growing, which is wonderful. What I'd love, we have been talking here a lot about, existing wrinkles on the face caused by smiling and different things, and specifically, the more we smile, the deeper the creases become. The older we get, the longer we have these wrinkles, and then they become crow's feet, and it just goes on. But let's talk about, preventative Botox, or as I know you've mentioned to me, is the trend of the baby Botox among the millennials. I think I'd love to hear more about preventative Botox.
Oh my God, Angela, you got my favorite question there. So yeah,
Right.
Just to give you a little history, we look at the history of neurotoxins right here. The use of neurotoxins from 2000 to 2019 has increased from, to 878% in the United States. And if we look at that alone in 2019, we had like this 20% of the patients were between the age of 20 to 39, which is revolutionary. And why is that? So we have this new concept, what we call is preventative Botox or baby Botox. There was actually a little while ago, there was a video on TikTok of this young lady, 28-year-old lady, talking about her experience getting the first Botox. 20-second video got like 2.2 million views. I mean, that's huge. So what is baby Botox? Basically, getting small amounts of Botox in the areas where we actually get the wrinkles most, which is your frown lines, the crow's feet area, or even the forehead lines, and basically preventing it. The concept of prevention, I mean, it's not new in the world of medicine. We talk about preventing heart disease, preventing diabetes by taking and getting started early. So down the road, you don't have to face those aging, the problems of aging, getting the wrinkles. So starting early and then kind of continue going on, which is where we are going at this point of time, and I think it's where we are moving towards.
And so with a baby Botox, what is the typical age group of this patient?
So, I mean, again, according to FDA, I mean, anybody who is an adult, 18 and above, you guys can get started with this. And whenever you feel comfortable. So typically, I would see people in their 20s coming in and requesting this. Maybe they were on a Zoom call with a friend or on a business meeting, and they saw this small wrinkle, or maybe they didn't see it, but they're seeing the other colleagues having wrinkles. That's when they realize, well, they need to start getting on preventing it. So coming in early, in your 20s, in your 30s, before even you get to your 40s, to get started with smaller dosages and preventing getting the wrinkles. So yeah, I would see it in early 20s, people coming in and getting it.
Yeah. Now, I know that you do have a special rapid facial wrinkle reduction technique that you've mentioned in the past, and I think this is like your special way of an approach to patients. So can we talk about that a little bit? Your selection of injection site, and do you have any combination use of products?
Of course. So, whenever actually a patient or client comes to me for the consult for first time, first of all, of course, we have a detailed medical history to make sure they're healthy. Assessing them, I mean, looking at them for what they are coming for and for what we see. I mean, discussing, these are the concerns, whether it's the number 11s or whether it's the crow's feet or whether it's the forehead horizontal lines. And I see more and more men coming, lawyers, I mean, people in where they have where they frown more. I mean, you see these frown lines. So coming in with those concerns and then assessing them, looking at the needs, then forming a plan on how we will move forward with it, whether they just need neurotoxins, whether they do need more than that, some combination products, what would be the amount to be placed in each area. Of course, there are some recommendations by FDA, by different companies on their products, or this much amount in forehead area, this much in, but if that's where an expert injector, that's where, we come in. I mean, we talk, we decide, okay, I think this is more prominent for you, so we need to be putting more here, less there. Deciding on the amount, how we will distribute, then knowing where you are injecting. People would think, oh, it's an easy, simple thing, which it is, as long as it's done in the hands of expert injector. So knowing the depth of placement. So those are very, very important questions and decisions which you have to make when you are making an appointment with the provider, and then the provider has to decide that. And for that, they really need some skills, some expertise, some experience over time. I mean, as much as I am doing this for a long, long time, I learn every day. I innovate every day. I change my techniques every day to deliver the best results. So yeah, that's what we do, and I think that's how it works for rapid wrinkle reduction.
Oh, and I'm sure your patients must love having such a personalized approach to their treatment. Just a very quick question because we're getting close, being about halfway through the show. But I just want to ask you this one quick question, and then after that, I want to dive into the whole Hollywood Bollywood thing a little bit, if that's okay with you.
Of course.
Yeah, yeah. So the just quick question here is, neurotoxins, are they permanent? Do patients need future treatments?
Okay. Yeah, that's actually a very good question. So neurotoxins, let's say Botox for that matter, this is the best part, I believe, that they are not permanent. And why do I say this? Well, these products, as I said, they are really safe, they are predictable, they have a lot of clinical research and data behind them. They can be done very quickly, easy in and out. I mean, if you are coming to our office, you're out in 15 minutes getting them done. There is like literally no downtime to these products. In few days, and the result, the full effect takes in few weeks. But the part of the result is it only lasts so long. So usually the duration of most of these products is 12 to 16 weeks, which is 3 to 4 months. Also depends upon how much you place. If you are using the recommended dose by the provider, then the results would last longer compared to when you are underdosing or when you are, wanting less amount, they would last less longer. So that's a good part about it, because a lot of times people would come to me and say, "Oh, what if I don't like it?" Well, honey, if you don't like it, you can always not do it. But at the same time, I feel that if you like the results, people come back, they do it. These can be adjusted over time. So say if you came and you did it and you feel like you need a little less movement of your muscles, you come back and you add on a little bit more. It can be added on. But at the same time, if you feel like, maybe this time I would like to have a little bit more movement of my muscle when I'm smiling, when I'm laughing, well, next time you come, we adjust the dose, and it can be tailored to according to what you are looking for. So yeah, the results are not permanent; they are temporary. But at the same time, I think that's a very desirable thing, just because that helps you tailor, that helps you decide what you want to do. I mean, it's not like going under the knife, and once it's done, it's done. So it can be tailored, it can be adjusted according to your needs.
Yeah, I couldn't agree with you more, and I think that's a great point that, it isn't permanent. Therefore, if a patient isn't as happy as they expect it to be, or if it was a little too much for them or not enough, then they know the next time around just exactly what the right path is for them. So that's fantastic. So let's just quickly go into, I mean, we spend so much of our time looking at celebrities, famous faces, and we even see it in social media, in television, with all these before and after pictures, and people talking about what other people have done and comparing before and after. I'd just love to hear your take on that. I know you have a major passion for Bollywood, Indian movies, which I do too. I mean, I just
Of
can't.
course.
They're fantastic. But to be honest, I've never. I mean, I just see those actors as just being so incredibly beautiful that I never have thought of. Well, what are their before and after pictures? And is it obvious that they've had work done? Have they had work done? Or are they just naturally gorgeous? So, I would love to hear your take on that.
Right. I mean, I think they are all naturally beautiful, aren't they? I'm just kidding. So your question actually takes me back to, I don't know if you remember Samantha from Sex and the City. I mean, her saying this, that, honey, I don't believe in marriage, but Botox, on the other hand, it works every time. So,
Hmm.
it's been around the block, and celebrities using it for quite some time. It used to be a very taboo topic. People used to hide. I mean, celebrities used to hide what they are doing. But if you see now, the current social media has helped us destigmatize this once taboo topic. So there are celebrities who would come out. I mean, if you see how they looked at 33 and how they look at 53, you would see the difference. I mean, they're looking better at 53 than they were at 33. So obviously they are doing something at this point of time which is making them look good. And I feel now a lot of them are open about it. I mean, you look at Cindy Crawford. I mean, she's very open about what what she does. Cardi B, I mean, Katy Perry, all these people, they're open about using Botox. I mean, follow the Kardashians. I mean, they talk about their experience with different procedures, with different medical aesthetic procedures, and people just love hearing to them. They follow them, and so I feel that they are becoming more and more open. Talking about Bollywood, of course, I mean my favorite place to be. I mean Priyanka Chopra, Hollywood Bollywood in the celebrity, talked about in her recent release book called Untouched. I mean she talked about, or Unfinished, not Untouched. I'm sorry, Unfinished. She is talking about getting multiple rhinoplasties done. I mean how she getting started on those because she had a medical concern, and then she had to continue that in order to get the correction. I mean, Bollywood definitely is a little bit more shy at this point of time, but I feel there also we have a lot of young celebrities talking about it. Anushka Sharma, a very darling celebrity, talking about her experience getting the dermal fillers. So I feel that now people are becoming more honest, more candid, and more open about it, which is as people on the other side watching them, following them, we appreciate that.
No, yeah, and I think as well, there's probably other reasons why people would also be having these cosmetic treatments, and again, Botox specifically, or neurotoxins specifically, beyond just the aging aspect. What about special occasions? I mean, are there special events that you see are important business meetings, weddings, holidays? How is that in your practice? Do you see more of a rush, prior to these big events from patients, or is it pretty consistent year round?
Right. Well, again, like as the word is opening right now, there is this surge of patients or clients asking for these coming in. That's what we see. Usually, I mean, if somebody is contemplating getting it done, I would see most of the time they would come right before they're planning something, say going on a holiday or planning a meeting, business meeting, maybe going on a family get together. I mean, let's take, for example, wedding. I mean, that's one of the most important event in person's life. I mean, there is so much planning that goes behind it, from decorations to dress to hair to makeup. So thinking about your face, taking care of your face, taking care of your looks, enhancing those, that's one of the things that I see. I mean, I see that surge, not just the bride or the groom, but the whole family, like mother of the bride coming in, asking for these treatments. And because think about it. I mean, they do pictures, these timeless memories, and they want to look their absolute best. So of course, that's the time to think about getting these things incorporated in in your plans and getting them done.
Now, what about, like if not that a wedding would be a surprise, but some kind of things that are, getting ready for an important meeting, a first date, or even a wedding or any of these, is there like a time frame that you suggest to patients to make sure, that as quickly as it is to get a neurotoxin, there are still a couple of weeks or two before it takes hold and the patient is going to be, see the difference. What would you say would be a great leading time for patients when considering any aesthetic treatment?
Right. Well, that's actually a very, very good question. So typically, if you have never done any kind of aesthetic treatment, you're thinking about it. Even it's good to take a little bit of time, few weeks ahead of time. So let's talk about neurotoxin. I mean, Botox for that matter. Usually, we would say, well, there is no downtime, but the effect does take a couple of weeks to kick in. So starting out, I would say taking a month ahead of time before you're planning the wedding, before you're planning any kind of a special meeting or an event. That's a good planning. I mean, there are times where people don't have time; they just have few days. Can they still get treated? Well, sure, because really there is no or minimal side effects if you are, or I would say no side effects if you're actually doing in the hands of an expert injector. Results start kicking out. I'll have people walking out of the office and they feel like, oh, I feel like my muscles are a little tighter. I'm looking a little smoother on my forehead. So, the people would see. There are other things that, we would do, say lip flip, putting a little bit of Botox right above your lip to make them look fuller. So those are the things that can be achieved like within days. So if you're really taking a time planning it, I would say take a month. Even if you don't have that, you're doing a week or two before. That's totally doable, and you will get the results.
Okay, well, that makes sense. So, I mean, definitely a month ahead of time. Do you ever have patients who kind of, like they say, I'm planning my wedding and, it's in 6 months' time, and they come to you even that early to then, for you to help give them a game plan for different things and a schedule? I've kind of heard of other people who do that, so I didn't know if that was something you did
Right.
too.
Right, right. Actually, I love when they come 6 months ahead of time to me. I mean, that's the absolute best time. That's exactly where you should be planning. I mean, you are planning everything else, and this is a part of your plan. I mean, that's the best time to be in my office talking about what your concerns are, what you're looking for, and then we plan together. I mean, we plan. You need just a neurotoxin? Maybe you need a little bit of filler in your lips. Maybe you need some skin enhancement with, say, PRP microneedling. So, formulating a plan, whether we are going to do it periodically, couple of times. Do you want to try the neurotoxin to see how you like the effect, how you like that little browlet? I mean, if you're, say, your face is a little, say, squarish, and you're looking for more feminine look, can you reshape the jaw? Of course, we can do that. We have to start out now where we inject the neurotoxins in your muscle around the jaw, and that helps thinning that muscle. I mean, necklines, taking care of those. So this is the perfect time. I mean, if you're in my office at Sigma, I'm the happiest person there, and we love to form the treatment and go along. And then, on your wedding day, I mean, there is no rush about it. You already know how it sets in, how it looks on you. So we already have a plan for you, and we kind of just follow that.
Yeah, and I think as you mentioned earlier, things are opening up and more people are feeling more comfortable with making a plan for things.
Yes.
So that's great news. Well, my last question for you today, Dr. Agarwal, is, obviously all of us experience the physical changes of aging, and we've talked a lot about, motivation for having a cosmetic procedure, but for that person who has not had any treatment done yet, and they are looking at themselves and thinking, I really, it's time for me. How does a person kind of make that decision and choose and say it's time to consult with Dr. Agarwal?
Yes. Well, I would say if you're listening to me today and you think that you're looking for a natural look, for a fresher, rested, balanced look, you have questions and concerns. I mean, by no means today's talk is making a plan. I mean, it's just introducing you to what we have out there, what you're missing. I mean, if you're not getting toxed, well, girl, you need to call and make an appointment today. I mean, I have patients not just from the Hollywood industry, not just from LA area. They come from Orange County. They come from Bakersfield. They come from, they fly from East Coast. I have people flying from Australia and even India for that matter. And again, they do that because, they kind of believe that, when we plan together, they would get what they want or what they are looking for. So I really thank all my patients who put their trust in us. But at the same time, I mean, if you have doubts, do call today, make your appointment, and we would be happy to take your concerns and discuss. I mean, you don't have to do it, but at least questions.
And Dr. Agarwal, what is the best phone number and contact for you?
Sure. So to reach me or to reach our spa, call 310-314-0404. So we are Mia La Maven Med Spa located in Santa Monica. Our website is www.mialamavenmedspa.com. You can actually follow us on Instagram, Miala Maven Med Spa. Even my personal Instagram ID at Dr. Shweta AMD. So yeah, please follow us. Please like us. Do call and make an appointment, and we would love to see you and hear about your concerns.
Well, Dr. Agarwal, thank you so much for being on the Aesthetic Insider Radio Show. It's always a pleasure. It's always a pleasure. I just loved having this chat with you today, and I'm excited to have more conversations with you in the future.
Likewise, Angela. I mean, it has been my pleasure. I don't even realize that we came to the end of the show. I was just talking.
It goes so fast,
yeah,
doesn't it?
definitely. We would love to continue growing. And thank you.
Absolutely. Well, thank you, and have a wonderful day.
You too. You take care.